Good morning. I'm Eileen Doherty, Executive Director of the Colorado Gerontological Society. As the director of the society, a nonprofit organization, older adults often tell us they didn't know about many programs, services, and benefits for which they are eligible. One of the main goals with this radio program, Senior Answers, in partnership with Legends Radio, is to share information and help you take advantage of these programs. Before we start this morning, I want to tell you about some incorrect information I gave you last month. I had indicated that the portability bill, which was the ability for people to take the senior homestead exemption and claim it if they had lived in their new home for less than 10 years, they would be able to get the property tax exemption. That bill did not pass the state legislature, so we will have to work on that again in the future. Now for what we're going to talk about today. Most older adults themselves want to live in their own homes for as long as possible. Safety becomes a concern for both the older adult, who is sometimes afraid he or she will fall, forget to do important tasks such as take their medications, or just don't feel well, but don't really have much outside contact with the world. Years ago, Colorado began a program called the Home and Community-Based Services as part of the Medicaid program. The goal of HCBS, as that program is known, is to keep people in their own homes, specifically through the Elderly, Blind, and Disabled program. If you meet the functional and financial requirements, you can qualify for a number of services in the home, such as medication monitoring, bathing assistance, help with laundry, cooking, cleaning, and more. You can also qualify for support from a life alert system, which you can use to call for emergency help if you need it. Today, we're going to learn more about another service that is available to support people in their own home, known as remote services. We have with us today Derek Williams. He is the owner of ComForCare Remote Support for Colorado Medicaid patients. Welcome, Derek.
Good morning, Eileen. Thank you for having me.
You bet. So many of our listeners are eager to learn more about innovative ways to use technology to successfully stay in their own homes. Tell us more about the remote support program and what services can be provided to augment the in-person home care.
I'd be happy to do that. And I'm going to steal the definition of remote support from Colorado Medicaid. You can find that on their website. But remote support service provides live, two-way virtual coaching, supervision, and cues from a virtual attendant for everyday activities of daily living that do not require hands-on assistance to be completed safely. And these supports can help you live more independently in your home and community. Services may include prompts and reminders for such needs as dressing, cooking support, overnight support, and also fall detection. The remote support technology is included to purchase and install devices that support the delivery of remote support. And remote support includes the technology to support virtual live interactions and the member's independence. And it is available through the Community First Choice and Home and Community-Based Services waivers.
So tell us what you mean about virtual supports. Are there cameras or other alert devices?
Very good question. So I can only really speak for the services that my company provides. There are many providers of remote support services in Colorado, and you'd be able to find them on the Find Doctors website through Health First Colorado. That website is www.healthfirstcolorado.com/find-doctors/. But for my services, the only cameras that are available is through our virtual caregiver program, which we provide an application, and then the camera is run through a tablet or a smartphone, and you can do a Zoom-style conference with the virtual caregiver to help do the prompting and check-in calls. Most clients tend to prefer a phone call and do that type of thing through the phone. Otherwise, with our fall detection devices, those use four-dimensional radar, so there are no cameras involved with those, and they are able to tell if someone has fallen, and it gives them some opportunity to get up off the floor before the remote care coordinators are prompted and alerted that someone has potentially fallen, at which time they will call the member to check in on them and also work through a phone tree if the member doesn't answer, so that we can get someone to come and help the Medicaid member who may have fallen. And then finally, with the virtual caregiving program, we also have motion sensors and chronic disease management technology, and that includes motion sensors, a pulse oximeter, a blood pressure cuff, and a scale. And all of those give us more information on the member's health and use that to monitor their overall well-being, and it can alert us to anyone that may potentially be getting or developing an issue that may require that they get hospitalized.
So it sounds like when we think about remote support, the first thing maybe our minds go to is, they're going to put cameras everywhere and I won't have any privacy. What I'm hearing you say is we do use a lot of technology, but we use phones, we use motion sensors, we use other kinds of devices that basically give us feedback and information. So maybe some of your individual privacy is given up, but it's not via a camera. Is that accurate?
Yes, it is. That is accurate.
So how do people sign up for this program? Do they need a referral, approvals, assessments? How do you take advantage of it if you want it?
Very good question. It is available through a private pay option. If you would like that, you can just call my agency at 303-515-6755. If you are a Medicaid member, what you will need is a home and community-based services waiver. So some of those waivers are known as the community first choice waiver, the brain injury waiver, the elderly, blind, and disabled waiver, complementary and integrated health waiver, etc. So chances are, if you have one of those waivers, then you are working with a case management agency, and what you need to do is tell your case manager, the case management agency, that you would like remote support service. And then they will probably give you a list of providers to reach out to. However, one way that you can approach it is if you like the idea of the remote support services that my company offers, you can give us a call first. We can kind of talk a little bit about your situation and your needs, and then the process is still the same. You would need to request a service from your case manager at the case management agency, and then they would put together the prior authorization so that we can set your services up.
And so if people are not very familiar with the Medicaid process, if you're already on Medicaid, the home and community-based services, this probably is a relatively easy service to increase or add to your current package of services. If you're not on home and community-based services, then, and you're not on Medicaid, the very first action that you would need to take is to contact your county Department of Human Services and fill out the financial section of the Medicaid application, which you can do online, or you can download paper applications. And then if you, from there, or you can do that, and you can do that at Colorado Peak. Or you can then, if you're not on Medicaid, and then after that is approved or as part of that next step, you can then contact your case management agency. And there are quite a few of those around the state as well. And if you Google Colorado case management agencies online, you'll get a list of those and what counties they cover. So it's kind of a twofold process, if you will, to get on Medicaid. You both need to be eligible financially, and that means if you're a single person, you can't have less than $2,000 in the bank and about $3,000 in income. If you're a couple, you can have a little bit more money, but less than about $150,000 in the bank. And again, the individual is going to then need to be eligible in terms of needing a lot of different services. But it's always worth checking because there's lots of services available. So how do families and significant others fit into this?
So many times with family and significant others, they're providing some caregiving support, or they're nearby and they're, of course, concerned about their loved ones. So family, it really depends on their level of involvement with their family member. We have some who are very involved that live several states away, and they love that there is a remote support team providing 24/7 supervision of their family member, and also monitoring their vitals and things like that. So in that case, it's a nice peace of mind benefit to family. The other way too is buy and be primary caregiver, but of course they're not always in. And so with the fall detectors, the way the program works is if someone falls, they have a couple minutes to get up, and if they don't, we work through a phone tree to send someone to the home to help them. And in a number of cases, the second person that's called is a family member.
We're kind of out of time today.
Okay.
So if you do need these services, please contact Derek's office. And thank you for joining us today, Derek. If you have any questions, you can visit our website at senioranswers.org or the YouTube channel. And we will eventually have this posted on our YouTube channel at Colorado Gerontological Society. If you still have questions, you can call us at 303-333-3482. Again, 303-333-3482. And a big thank you to Legends Radio for supporting this program to bring information to older adults in Colorado.